For those of you who know me, I'm really skeptical when it comes to skin tightening devices. I've never had my lower 1/3 of my face done, but over the last few weeks I've been using New Era and it's absolutely mind-blowing. It firms up your skin like no other treatment. The downtime is zero and it actually feels pretty good. So let's go. Hey guys, Davin Lim, dermatologist. Today we'll be talking about a particular skin tightening device. It's called radiofrequency. Now, radiofrequency can be delivered in several ways, including RFM, which is called radiofrequency microneedling, but it can also be used as a device that provides heat, slow heating in the dermis and in the lower part of your subcutaneous fat, as well as your layer called the SMAS layer as well. So how do I employ radiofrequency in treating people with lax skin? First of all, I like to assess the patient, and we need to see that they will have clinical findings that will be conducive to radiofrequency. In other words, mild or mild to moderate laxity, usually of the face and neck, preferably in someone who has not got any sun damage, because if you have sun damage, your elastic fibers are broken, which means when you're trying to contract something which is broken, it's not going to work. So people with a lot of solar elastosis or sun damage, generally speaking, I pick lasers or deep peels because that can repair the dermis, and once it's repaired, it can contract, and using another device, it can contract even further. So in the context of skin tightening devices, where do I rate radiofrequency? So radiofrequency is around mid-level. You have many different types of radiofrequency device. Like I said, you can have the radiofrequency microneedling. You can have a gentler process, something like temperature or the old-fashioned Pellevé, right? And then this is a new generation. It's called New Era, and it's made by Luminous. So that provides moderate contraction in the space that we want. Right? Going down for there, they're usually more powerful devices. So things like HIFU, high intensity focused ultrasound, something like Ultherapy or Ultraformer. Now, how do all these devices compare? Generally speaking, with someone who's got, for example, a thick dermal layer, I may use something like HIFU because it is much more effective if your dermis is thick. For this, the beauty about this is that it does not have downtime and it does not hurt. The downside about HIFU is that you can get some bruising, especially if you use the 1.5 mil transducer. And with HIFU as well, it really hurts. So sometimes patients can't go through that. When you look at RF devices, I like to really say it as much like microwaves, yeah? So you can have a slow heat defrost, something like Pellevé temperature. You can have something like this, which is medium. You can have high heat, so something like radiofrequency microneedling, where each pulse that you have a huge amount of heat within that 1 second or even half a second. And then you can have more powerful devices, something like your thermage. So in most situations, I prefer this. In some situations, like I'm tightening the neck area or jawline area when I'm doing things like liposuction or laser resurfacing, that's when I choose something like radiofrequency microneedling. But the device that I use most is this. It's Risen, like I gave you, zero downtime. It works well if you select the right patients. Guys, I hope you liked that video and I hope it explains how to use radiofrequency in your skin tightening journey.